What if you were having a stroke and you thought it was just stress, exhaustion, or even hot flash? Well, this is exactly what happened to Dr. Sandra Lee, better known as Dr. Pimple Popper. Despite being a physician, she overlooked some early signs. And if this can happen to a doctor, it can happen to just about anyone. If you're a woman over 50, this is a conversation you need to hear because recognizing stroke symptoms quickly can literally save brain tissue, function, and even your life. I'm a physician with expertise in neurorehabilitation, brain injury medicine, and lifestyle medicine, and I have worked with many stroke survivors during the rehabilitation process. And today I want to use this very public story as a teaching moment. This is not about fear. It's about awareness and prevention and knowing when to act fast. So again, Dr. Sandra Lee, she's a dermatologist and a television personality widely known as Dr. Pimple Popper. She recently revealed that while filming her show, she began experiencing symptoms that did not feel right. At first, she brushed some of them off. Later, she learned that she had experienced an ischemic stroke, and I'll talk more about that later. And this is one reason stroke can be dangerous. The symptoms are not always dramatic at the beginning. Sometimes people explain them away. Here's what she noticed. She said in recent interviews that her symptoms included things like sudden sweating, feeling off, trouble walking. She even mentioned slurred speech or difficulty articulating, weakness involving the left side, and she had trouble with hand control and coordination. And those are not symptoms to watch and wait. Those are symptoms to treat as an emergency. So let's talk about what is a stroke. A stroke happens when a part of the brain is injured because blood flow is interrupted or because a blood vessel bleeds. There are two main types of stroke. One is an ischemic stroke. This is the most common type, and it happens when the blood vessel that supplies the brain becomes blocked, often by a clot or a narrowed artery. Sandra Lee reported that this was a type of stroke that she experienced. The second type is a hemorrhagic stroke, and this happens when blood vessels in the brain ruptures and bleeds. There's also something called a TIA or a transient ischemic attack. Sometimes people refer to it as a mini stroke. Even if symptoms go away, it is important to know that it's still a medical emergency because it can be a warning sign of a bigger stroke ahead. Now, what are some of the risk factors? In Dr. Sandra Lee's case, she reported risk factors such as high blood pressure, high cholesterol, and stress. But more broadly, risk factors include high blood pressure, particularly if it's not controlled, high LDL cholesterol, diabetes or insulin resistance, smoking, atrial fibrillation or other heart conditions, obesity, physical inactivity, sleep impairment, chronic stress, increasing age, uncontrolled diabetes. And this is where many women get caught off guard. Sometimes women minimize these symptoms as just being busy, they're caregiving, they're fatigued, they just push through the discomfort. This is what I need you to know. Stroke symptoms should never be brushed aside. Let's talk about BEFAST. It's an acronym that helps you identify stroke. B is for balance. So sudden dizziness, loss of balance, or trouble walking. E, eyes, sudden vision loss, double vision, or visual changes. F, face, facial drooping, uneven smile. A, arm, weakness or numbness, and this is often on one side. S for speech, slurred speech, trouble speaking, or even trouble understanding. T for time, time to call 911 immediately. Do not drive yourself. Do not lie down and hope it passes. I've had several patients do this. Don't do it, please. And do not wait until the morning. Your job is to call emergency services immediately or have a family member do so on your behalf. The reason fast treatment matters is when someone is having an ischemic stroke, every minute can determine whether brain cells live or die. Early medical treatment can improve outcome dramatically. One reason speed matters is that some patients may qualify for clot-busting treatment, such as TPA, if you arrive within the appropriate window and if you meet certain eligibility criteria. This is why recognizing symptoms and seeking emergency care immediately is so important. I will tell you that in rehab, I've seen firsthand how much of a difference early treatment can make. I've had patients with similar type of stroke, and one do much better than the other because one arrived much sooner and received the treatment that was necessary to improve their outcome. This story is also a reminder to stop assuming stroke is something that happens to other people. We do that sometimes, right? Here are a few basics. Please know your blood pressure, know your cholesterol number. Do not ignore neurological symptoms. Prioritize things like sleep and stress management. Move your body regularly. Eat in a way that supports your vascular and brain health. And follow up on things like diabetes, heart rhythm problems, and other medical risk factors. And if you want a simple place to start, I have created a free resource for you that was designed specifically for this. It is called the Brain Health and Stroke Risk Power Up Checklist. It's going to walk you through the key lifestyle and vascular risk factors, and you can score yourself across multiple categories and come away knowing exactly where your strongest opportunities are. You're going to find this in the link below. So go ahead and check it out. It's free. Dr. Pimple Popper's story is powerful. It's a powerful reminder that stroke happens even to educated, high-functioning, busy professionals. And it can happen to you. The lesson, though, is not to panic. The lesson is to pay attention. If you notice sudden weakness, speech changes, facial droop, trouble walking, or vision loss, think BEFAST and get help immediately. Your brain is too important to delay. Now, if you found this helpful, share it with another woman over 50 in your life. It could make all the difference in the world. And of course, thank you so much for watching.